Okay, now let's see how is the anatomy of the tooth, and also how how a dental decay can be started. So here you can see structure of a tooth. It can be divided into two portions, the crown portion and root portion. Look at the gingiva and also the bone surrounding of a tooth. So in the next videos we are going to talk about this, what is the healthy gingiva, what are the problems. Sometimes the color of the gingiva will be different, especially if you are wearing a jacket crown, if it is turning to black or something like that. What are the signs, what does it mean, and how you can treat them. So this is the enamel, and in the enamel you have some structures like the fissures that on top, on the occlusal surfaces you can see, and the surrounding of the tooth, as you can see here, is like a sulcus around the tooth. And this area is very important because you cannot clean this area using toothbrush, so only dental floss can clean. So you should bring the dental floss into this area, which in normal situation is about 1 to 2 millimeter in depth, and you can clean this area only by using dental floss. And then you have the enamel, which is a non-vital structure, and it's very good, but just imagine if it was vital. So every time you wanted to eat something, how much pain you had to tolerate. So it's non-vital, no sensation here. But underneath you have another dental structure which is called dentin. Dentin has some structures like tubules or channels, which is connected to the most vital part of the tooth, which is dental pulp. As you see, it contains blood vessels and nerves. So these blood vessels and nerves are coming into the tooth from the tip of the root, which is called apical foramen, or hole here, opening, and this is the bone, and this is the gingiva. So when you eat, the food particles, they have tendency to stay in this sulcus and also in the fissure most of the time. So this is an example. As you can see this, please take note. It doesn't look in so bad condition, but only looking at the tooth will not tell you the story. So you are going to see after eating that a layer is on your tooth, which is called biofilm. It's a combination of food and saliva bacteria, which is very much adherent to the tooth structure. So with a good brushing technique and using a good toothpaste, you can clean this area. But here you cannot use toothbrush to clean this area, and here is also very difficult or sometimes impossible to clean it. So after you try to clean, maybe you remove some parts, but you still some part of the biofilm, some part of the bacteria is still remaining there. So these bacteria can convert the food into acid. So the more food is there, the more acid is produced. So this acid will dissolve this structure of the enamel and will go down. And as I told you, this is not vital, so you don't feel any pain at this point. This is going to become bigger, and please look at the triangle. It means at the tip of the fissure you see nothing, almost very small, but the base is down. So it grows like this, so you don't see a big problem. As I told you, maybe the story is something else. There is a dental caries already. It grows down, still maybe no pain. As long as you get near to the vital part, the channels of the dentin, now these channels will provide an opening, and it will provide some pathways for the bacteria to come into the inner part of the tooth, I should say. So now the body has some reactions. That's the time you feel the pain. So when you feel the pain, you are already in this stage. It's not at the early stage. So that's why you need to have periodic checkup with your dentist, so you can treat at early stage. It's already a late stage. So your body is going to react, and when you reach this state, the base of the triangle is changing. So now you have a very wider area involved in this dental caries. Becomes like this after some time, and it's so fast because it is less mineralized compared to enamel. Therefore the progression of the dental caries is so fast. In addition, the number of bacteria is also much higher compared to early stage, so this is going to be much faster than the early stage. And look at this area of the enamel, so it doesn't have support. So sometimes it happens in this situation, when you are eating something, suddenly it will break, and then that's the time you see, wow, there is a big dental caries, and you never saw that. So now, since this area is removed and is softened because of the acid of the bacteria, you will have problem of breakage of this undermined enamel. And now this kind of, if not broken, so the bacteria will now enter to the pulp chamber, and the reaction is going to be more. You will have more pain, and this will grow. So there are sometimes you feel the pain, and after some time the pain is already gone, and you think, okay, I'm okay now, no more pain, I'm well. But it's when you have the pain, it means the body is involved, showing reaction. And when the pain is stopped, it's a bad sign, perhaps. It means the body has lost, so the bacteria is the winner. More bacteria is coming, occupying all the chamber, going down all the way, occupying and going down to this area. And then you are going to have sometimes swelling of your gum around the root area of your teeth. Then you have to go to the dentist. And in this stage, since it's a very late stage of the disease, you don't have that much options. So root canal therapies, removing, cleaning this area, and then filling the canal, and then filling the canal, and also the crown portion, perhaps you have to make a jacket crown to protect the root area. So in this last slide, I want to show that when you are using a dental floss to clean your teeth, sometimes some people, they think it's the only area that you need to clean. Of course it's very important, but you should move your dental floss going down all the way into the sulcus to this area which is called attached gingiva. So you should move your dental floss. So in the next videos we are going to talk about the good dental floss and how to use the dental floss properly.